Really want this to be unscripted. We want your raw, organic responses, and we want to just tap into your expertise regarding the problems and the solutions. So we're just going to be very informal about this. We really want this to be a true give and take between everybody. So let's start with a very simple question about healthcare. What's broken?
Everything.
Yeah.
Everything in healthcare is broken. Healthcare is based on a for-profit mentality, which for-profit has really not a whole lot to do with care. The issues of ownership and payment for product line and who's in and who's out. 50 million people uninsured tends to be a large problem. I'm in competing interests of both for-profits, not-for-profits, hospitals, insurance companies, pharmacies, R&D. Everyone has a competing interest instead of looking at the singular focus, which should be the outcome of what is a good patient outcome. And there's no connection between quality outcomes and the cost of doing business. There is nothing that connects the two. And there is no integration within the delivery system anywhere, any place, anytime.
But absolutely right. We do need a system that's going to be aligned and focuses our outcomes for patient care, and a system that's going to provide care for everybody in the United States. The biggest issue that I see right now, jumping ahead, is what is being proposed as healthcare reform is really not healthcare reform. It's taking the same system that we have and trying to spread it across everybody and try to do that with the same amount of money without fixing the inherent problems that are already in the system.
So it's taking the same broken system and trying to jerry-rig it. Yeah.
Right, and hope that it's going to cost less in some way.
Yeah, right.
I'm really disappointed that if it is greed is dictating whether or not people will live or die. If you have to shop around for a plan that will cover a condition or have somebody in a cubicle telling you that you are denied a potentially life-saving treatment, and they can make that snap a decision based on your coverage, that's very dismaying and deflating, and it just really, I don't want to pay for that. So I'm carrying the flag that I refuse to have coverage if it's going to cost me an arm and a leg and not do me a lot of good. Now you have to shop around and hope for the best. We shouldn't have to live on hope. We should worry about getting better.
As an employer, I'm very proud of the policy we offer our employees. Since 1984, when we started our company in 1984, we provided 100% insurance. We did all the premiums, both family and single. We went from 1984 to 2004, 20 years. When it got to the point where it got so expensive, we had to cut back. We went to 75-25. And we grandfathered all our employees that started before 2004, and we still pay 100% of their family and single plans, and we're very proud of it. It's just the pricing that's strangled us small companies. We're taking the monies now between the taxes. We have an 8% sales tax now on health insurance, and the government's talking about maybe another 8%. That's 16% in tax of insurance. That is strangling us. That's affecting us ability to grow. So we're taking just the 8% alone. We're looking at just in the 8% tax alone, $3,500 a month extra in tax we're paying, which is equivalent to a $450,000 mortgage. It's very difficult to grow your company when all your money is going to provide health care.
I think we're not getting what we're paying for. We pay twice as much as any other industrialized country per person for health care costs, and the outcomes aren't as good. And there's something wrong with that. And the question is why are we paying so much more? Where is all that money going? Is it going to outcomes? No. It's going to incomes. What I see as a family practitioner is I see gross overutilization of certain very expensive modalities of our care. I cannot tell you how many times I have a young person with who has a sore back end up in an emergency room setting, and they get an X-ray of their back, which is totally unnecessary in 99.9% of the cases. They end up getting an MRI, which is also totally unnecessary in 99.9% of the cases. on the very initial visit, when all they really needed to do was go home, lie down, put in a heating pad, and lift their legs up. Do we need to make that a $2,000 bill just because they have a sore back? We're padding the bill, and it's not changing the outcome whatsoever. And
we are padding the bill, but we classified that under emergency rooms, and on that one,
I'm sorry, for missing,
It happens in doctors' offices too. They'll
I'm
do
sure it
the
does.
X-rays, and
Sure,
if they've got
sure.
an MRI, they'll do the MRI,
Right.
the CT, and whatever. But also in the emergency rooms, under a lot of the insurances nowadays, because David doesn't practice on the inpatient side.
No.
Most of the emergency room cases fall under the equivalent of a DRG. You get one lump payment no matter what you do,
Okay.
based upon the diagnosis that you're there.
Right.
So the incentive for the emergency room most of the time nowadays just isn't there anymore.
It's just to cover your behind.
Yep.
Jim, if we go back to, when I was a kid, some 50 years ago, we had a doctor who took care of us from cradle to grave. I mean,
Right.
you had your practitioner, he came to your house, had a little bag. When my mom and dad couldn't always afford to pay for that bill, he stayed for supper. And, that's kind of how it worked. You went to the hospital only if you really had to go to the hospital. And so as you look at how we've progressed, we've become much more specialized. We've moved away from that primary care practice, and we've gone into tertiary care. We've gone into subspecialty care. We've moved away from the medical home. We've moved away from that doc who knows you from cradle to grave. And so instead of calling the good doctor at 2 o'clock in the morning when you have a 103 fever for your child, the immediate response is go to the emergency department instead of picking up the phone and say, what should I do? If you build it, they will come. If you build it, they will use. And I think that's what we have created. I have to agree with you wholeheartedly on the tort. I mean, we have created a world where doctors are supposed to be infallible. You are never to make a mistake. And I hate to say this, you don't walk on water, even though some docs think they do. But they don't. And a mistake sometimes happens. And if it's a mistake that's done outside of scope of service, then there's a real lawsuit there. But if something happens that you have no control over, that's where the defensive medicine comes in. And the cost to do defensive medicine and to second guess yourself, to third guess yourself, layers your cost. I kind of disagree that the physicians have a lot of control about that cost and payments. Depends on your payer. If you have a managed care company, you're picking up the telephone and you're talking to an RN who's looking up on the computer. If you have X and Y, then you should do Z. And the doctor is removed from how do you manage that case. Doctors are second, third, and fourth guessed about what their outcomes and their decisions are. You are disincentivized from taking steps that you probably should take to look at a case to control cost. And so when you look at what's broken, I said it was broken on all levels. It's broken on all levels. And at the end of the day, those of us that are lucky enough to have a health insurance plan, we never think about what the 50 some odd we underreport. That 47 million cannot be real. Not with the downturn, not with the people who have lost their jobs, not with the people who have lost their health insurance. That number must be much higher. Does anybody think that there's no cost to providing health care for that population? Mm-hmm. It's the most expensive population to work with because they don't have a medical home. They're not accepted in some practices where it's common that you don't take any more than 2% Medicaid and you take no uninsured. And if the uninsured come in, it's cash on the barrelhead. You don't pay the 120, the 150, the 200. You don't get care. So what alternatives are we giving them? Go to your emergency department, which is the worst case to go into. There's no continuity of care, and you're going at the worst time when you're in crisis.
Absolutely.
That's what the problem is with healthcare. We are not a preventive program. We are a crisis-oriented program.